Could the food you eat daily be harming your prostate? The answer might surprise you. In this video, we're uncovering 7 common foods that could be affecting your prostate health. You might think your diet is fine, but wait until you hear about number 4. It's something most people eat every single day without a second thought. You won't believe how these foods can impact your body. Stick around to find out which ones you need to avoid to keep your prostate in top shape. Let's dive right in. First, we have grass-fed meat. One of the primary concerns with grass-fed meat is its high saturated fat content. While grass-fed meat tends to be leaner than grain-fed meat, it still contains significant levels of saturated fat. Saturated fats have been linked to various health issues, including heart disease and inflammation, which can indirectly affect prostate health. Chronic inflammation, in particular, has been associated with the development and progression of prostate cancer. Another factor to consider is the presence of omega-6 fatty acids in grass-fed meat. Although grass-fed meat typically has a better ratio of omega-3 to omega-6 fatty acids compared to grain-fed meat, it still contains omega-6 fatty acids, which can promote inflammation when consumed in excess. An imbalance in the ratio of omega-3 to omega-6 fatty acids can lead to increased inflammation, contributing to the risk of prostate problems. Hormones naturally occurring in beef, including those found in grass-fed varieties, are another area of concern. Even without the added hormones that are often given to grain-fed cattle, grass-fed meat still contains natural hormones that can impact human health. These hormones, such as estrogen and testosterone, can influence the development and progression of hormone-sensitive cancers, including prostate cancer. The consumption of meat with these natural hormones might therefore pose a risk to prostate health. Iron content in grass-fed meat is another aspect to consider. While iron is an essential nutrient, excessive iron intake has been associated with an increased risk of cancer, including prostate cancer. Grass-fed meat is rich in heme iron, which is more readily absorbed by the body compared to non-heme iron from plant sources. High levels of heme iron can contribute to oxidative stress and DNA damage, both of which are factors in cancer development. Next, we have pecans. One of the primary concerns with pecans is their high fat content. Although pecans are a good source of healthy fats, including monosaturated and polyunsaturated fats, they also contain a significant amount of saturated fat. High intake of saturated fats has been linked to an increased risk of developing prostate cancer. This type of fat can promote inflammation and the accumulation of fat in the prostate gland, potentially leading to cancerous changes. Pecans are also high in calories. Regular consumption of high-calorie foods can lead to weight gain and obesity, which are risk factors for prostate cancer. Obesity can influence hormone levels, particularly increasing the production of estrogen, which has been associated with the progression of prostate cancer. Maintaining a healthy weight is crucial for reducing the risk of prostate issues. Another aspect to consider is the presence of phytosterols in pecans. While phytosterols are generally known for their cholesterol-lowering effects, they can also mimic and interfere with hormones in the body. This hormonal disruption can potentially influence the development and growth of hormone-sensitive cancers, including prostate cancer. The impact of phytosterols on prostate health remains a complex and debated topic. Oxidative stress is another factor to consider when examining the potential risks of pecans. While pecans are rich in antioxidants that can combat oxidative stress, they also contain certain compounds that can generate oxidative stress when consumed in large quantities. Oxidative stress can damage cells and DNA, leading to cancer development, including in the prostate. Aflatoxins, toxic compounds produced by certain molds, can contaminate pecans. These toxins are potent carcinogens and have been linked to various types of cancer, including prostate cancer. Ensuring that pecans are properly stored and processed to minimize mold contamination is crucial, but the risk of aflatoxin exposure still exists. Next, we have saturated and trans fats. Saturated fats, found in animal products like meat and dairy, as well as certain plant oils, can contribute to an increase in cholesterol levels. Elevated cholesterol levels are associated with chronic inflammation, a condition linked to the development and progression of prostate cancer. Inflammation can create an environment conducive to cancer cell growth and proliferation, thereby increasing the risk of prostate cancer. Another way saturated fats can harm prostate health is by influencing hormone levels. Diets high in saturated fats can lead to increased production of certain hormones, such as testosterone, which have been implicated in the growth of prostate cancer cells. The link between diet, hormone levels, and cancer risk underscores the importance of monitoring fat intake for those concerned about prostate health. Trans fats, commonly found in processed and fried foods, are particularly notorious for their adverse health effects. These fats not only raise bad cholesterol, LDL, but also lower good cholesterol, HDL, creating a dangerous imbalance that can lead to cardiovascular disease. This imbalance is also linked to increased inflammation, which, as mentioned earlier, is a risk factor for prostate cancer. The impact of trans fats on cell membrane function is another area of concern. Trans fats can incorporate into cell membranes, disrupting their normal function and making cells more susceptible to damage and disease. This cellular disruption can contribute to the development of cancerous changes in the prostate. Both saturated and trans fats can also contribute to obesity, a known risk factor for prostate cancer. Excessive fat intake leads to weight gain and the accumulation of adipose tissue, which can produce inflammatory cytokines and alter hormone levels. Obesity is associated with higher levels of insulin and insulin-like growth factors, which have been linked to cancer progression, including in the prostate. Next, we have spicy foods. One of the main components of spicy foods is capsaicin, the compound responsible for the heat in chili peppers. Capsaicin can irritate the bladder and urinary tract, potentially leading to inflammation. Chronic inflammation in the urinary tract can extend to the prostate, contributing to conditions such as prostatitis, which is characterized by swelling and pain in the prostate gland. Spicy foods can also exacerbate symptoms in individuals with existing prostate conditions. For example, those with benign prostatic hyperplasia, BPH, a common condition in older men where the prostate gland is enlarged, may experience increased urinary symptoms such as urgency, frequency, and discomfort after consuming spicy foods. This irritation can worsen the overall quality of life for individuals managing prostate issues. Another concern with spicy foods is their potential to increase oxidative stress. Capsaicin has been shown to generate reactive oxygen species, ROS, in certain conditions. While ROS play a role in normal cellular functions, excessive ROS can lead to oxidative stress, damaging cells and DNA. This oxidative damage is a known factor in the development and progression of cancer, including prostate cancer. Inflammation is a significant risk factor for many chronic diseases, including prostate cancer. Spicy foods can stimulate the release of inflammatory mediators, such as prostaglandins and cytokines. Chronic inflammation resulting from the regular consumption of spicy foods may create an environment that promotes the initiation and progression of cancerous cells in the prostate. Certain spices used in spicy foods, like black pepper and curry powder, contain compounds that can act as irritants to the mucous membranes of the digestive and urinary tracts. This irritation can lead to inflammation, which, when persistent, may contribute to prostate problems. The long-term impact of these irritants on prostate health needs further exploration, but the potential for harm exists. Next, we have sugar. One of the primary concerns with high sugar intake is its role in promoting obesity. Excessive sugar consumption can lead to weight gain and obesity, both of which are risk factors for prostate cancer. Obesity is associated with increased levels of insulin and insulin-like growth factors, which can promote the growth and progression of cancer cells in the prostate. Sugar can also contribute to chronic inflammation, a condition linked to the development and progression of many diseases, including prostate cancer. High levels of sugar in the diet can cause spikes in blood glucose and insulin levels, leading to an inflammatory response. Chronic inflammation creates an environment conducive to cancer cell growth and can accelerate the progression of prostate cancer. Another harmful effect of sugar is its impact on insulin resistance. Consuming large amounts of sugar can lead to insulin resistance, where the body's cells become less responsive to insulin. Insulin resistance is a component of metabolic syndrome, a cluster of conditions that increase the risk of cardiovascular disease and diabetes, both of which are linked to an increased risk of prostate cancer. Excessive sugar intake can lead to oxidative stress, another factor contributing to prostate cancer. Sugar metabolism can produce reactive oxygen species, ROS, which can cause oxidative damage to cells and DNA. This damage can lead to mutations and the initiation of cancerous changes in the prostate gland. High sugar consumption is also linked to increased levels of advanced glycation end products, AGs. AGs are harmful compounds formed when proteins or fats combine with sugar in the bloodstream. These compounds can contribute to chronic inflammation and oxidative stress, further increasing the risk of developing prostate cancer. Last, we have curcumin. One concern with curcumin is its effect on hormone levels. Curcumin has been shown to interact with androgen receptors, which are critical for the development and maintenance of prostate tissue. Disrupting these hormone receptors can potentially interfere with normal prostate function and may contribute to the progression of prostate conditions, including benign prostatic hyperplasia, BPH, and prostate cancer. Another issue is the bioavailability of curcumin. Curcumin is known for its poor absorption and rapid metabolism in the body, which means that it often requires high doses to achieve therapeutic effects. High doses of curcumin can lead to adverse effects, including gastrointestinal issues, such as nausea, diarrhea, and abdominal pain. Chronic gastrointestinal problems can indirectly impact prostate health by creating systemic inflammation and stress. Curcumin's anti-inflammatory properties, while generally beneficial, can sometimes suppress the immune system. Immunosuppression can impair the body's ability to fight infections and may influence the progression of cancerous cells in the prostate. A balanced immune response is crucial for preventing the development and spread of prostate cancer, and oversuppressing inflammation might hinder this protective mechanism. There is also concern about curcumin's potential to interact with certain medications. Curcumin can influence the activity of enzymes in the liver responsible for metabolizing various drugs. This interaction can alter the effectiveness and toxicity of medications commonly used to treat prostate conditions, such as hormone therapy drugs for prostate cancer. Patients taking such medications should be cautious with curcumin supplementation to avoid adverse drug interactions. Some studies have suggested that curcumin might have a pro-oxidant effect under certain conditions, leading to increased oxidative stress rather than reducing it. Oxidative stress can damage cells and DNA, contributing to the development and progression of cancer, including prostate cancer. The dual nature of curcumin's effects on oxidative stress requires careful consideration, especially in individuals with a predisposition to prostate issues. Another aspect to consider is the inconsistency in curcumin supplements. The purity and concentration of curcumin can vary widely between products, making it challenging to achieve a consistent and safe dosage. Contaminants and additives in some curcumin supplements can also pose health risks. Ensuring high-quality and standardized supplements is crucial, but the variability in the market adds another layer of complexity to its safe use. Lastly, the long-term effects of curcumin supplementation are not well understood. While short-term use has shown benefits, the impact of prolonged and high-dose curcumin intake on prostate health and overall well-being remains uncertain.